So I'm up there flying over these things going, yeah, what if we crashed? What would that be like? And I don't know if it was the lack of oxygen from being at that altitude, but I was kind of like, this is weird because we're not supposed to be landing on this mountain over here. My light didn't start flashing in front of my eyes until I was hiking down Kalapatar.
You've done a lot of surgery.
Yeah, that would mean I'll be 10,000. I mean, a lot of surgeries. Yeah. So, I mean, they talk about 10,000 hours to be an expert. And I think I passed that a long time ago. And
There's like this ethical component. And I know the way that you practice, right?
well, that's a good point. It's a mixed blessing that I was never really that interested in business because I try to look at the interactions as more, as a doctor taking care of someone, whatever their problem is, whether it's cancer or it's a tummy tuck, so I'm still doing kind of the same type of thing, but I try not to make it transactional.
In this episode, we hear from Samuel Bartholomew, MD, a plastic surgeon with an accomplished track record, phenomenal story from childhood all the way through into today's world of complex medicine and where he's headed with everything that he's doing. It is one that will make you really think about a lot of things, and I hope you enjoy it. Welcome to the show. So let's take it all the way back.
Yes.
You know what? Like, for the people that don't know you, where does it all start, man? The podcast is called The Pathway to Peak Performance. It's all about kind of hitting that next level. You and I have had a lengthy conversation about that in a different point in time. But tell people about your pathway to peak performance and take us through. Roll with it.
Well, I think, I grew up in a lot of different parts of the country. So my dad worked for the federal highways. So I moved around every couple of years as a kid. And so, it was challenging having to adapt to new environments. But that was the upshot of that, is that I had to come in, be the new kid. And I think in looking back on it, that helped me be a little more flexible, a little more adaptable. And, if I can, get something positive out of that experience. And it was good. I lived in a lot of different parts of the country, lived near DC, lived in Wyoming, lived in Ohio, Washington State, and eventually went to school in San Diego, where I went to school for, college, med school. I think it was really just, I think a lot of those values that I have now were instilled as a young man. I think it comes from my parents in large part, and kind of a good work ethic. I think it was probably the biggest thing initially. I don't think it was as formed as much in this sort of idea of, how I'm going to perform and excellence. I kind of look at things a little differently now, but I think it was a work ethic. That's what I started with. And just to do your best, work hard, in this idea of, just not settling, I think I just got that from my parents and my, rest of my family. So I really had that ethic going into college, and it was just a matter of kind of finding where I was going to go. I felt like I had all this potential energy, and what was I going to do with that, and kind of what direction I was going to take in life. And that's what really took probably the longest amount of time when I was a young man, was figuring out, what direction should I go with this? And that's probably the biggest thing.
Yeah. So being a plastic surgeon, I guess we're going to kind of jump forward and jump backwards and stuff today. Being a plastic surgeon's, people don't realize, it's pretty heavy duty. It's a tough specialty.
I think it is. I enjoy, there's a lot of things about it that I enjoy that, I looked at a lot of different specialties when I was in surgical training. I initially trained to do general surgery. I'm board certified general surgery, and I wanted to be a liver transplant surgeon. That was kind of my aspiration when I was in medical school. I had a lot of, a mentor who was the chief of transplant, and I really just gravitated towards that environment. I thought it was very exciting, and it was cutting edge. And when I had a chance to do it a little more, so I went to general surgery residency, kind of got into that, and I just, I think it was really part of it was lifestyle. And I realized that I wanted to have a little bit more control over my schedule than I would as a transplant surgeon. So I began looking at kind of other options, and plastics was something that I looked at after about a year of research in tissue engineering when I was in general surgery. And I got a chance to shadow the craniofacial surgeon at OHSU for about several months. And I was it. I was hooked. And I liked the planning. I love the anatomy. It's a different it's creative problem solving, and they're really difficult problems, frankly. I mean, I think part of the reason that I really enjoy the reconstructive aspect, aside from the gratification I get from helping patients, is that it's really challenging. They come to me as a plastic surgeon to help fix problems that can't be fixed.
It was crazy. The other night, like we were talking, and you had just come out of the OR, or you're going back into the OR. I can't remember what it was, but you were gonna go in, and it was a lung and heart transplant. What was that?
Well,
I didn't even ask you about that.
it was this particular patient had a heart and lung transplant about a year ago, and developed some issues with an infection in the sternum.
Hmm.
So one of the types of reconstruction I do is sort of thoracic or reconstruction after heart lung surgeries, where folks will have infections or open wounds in their sternum, and they're really difficult, frankly. And there's different ways to manage them, but generally it involves moving muscle and skin to close these large holes, for lack of a better word. And so there are situations where I am able to help those patients close these wounds, get them kind of moving on, because the mortality risk, if you don't fix those wounds and they have an open chest where you can literally see the heart beating in someone's chest, is high enough where you want to fix them. So in this particular situation was difficult because patient's immune suppressed. So I'll be asked to come and assist with these cases, and so I get to come in, and it's it's an honor, frankly, to be able to help somebody when they're that sick. And, I have colleagues that are in cardiothoracic surgery that trust me to do this. And so, it's something I really take great pride in, and I can help at a really difficult time in patient's life. So it was, doing that reconstruction to close them up, basically, kind of get things healed up.
Got it.
So
very different than like the aesthetic work that you do. And
so plastic surgery has a lot of different subspecialties, and I really enjoy doing several of them. One of them being aesthetic surgery, but there's also this broad range of reconstructive surgeries too. So there are a lot of different situations where I help reconstruction after accidents, cancer, a lot of different, surgical issues that people have had, where I can come in and help them kind of repair the body and kind of move on. Because in a lot of these situations, people have been dealing with wounds for a year or more, where it's affecting their life. It's just a significant impact on their life and quality of life. So I can come in and help them kind of move on.
I imagine the breast reconstruction portion stuff too, from breast cancer standpoint, it's got to be.
That's really gratifying too. So that's a big part of my practice, is breast reconstruction, and that is changed and evolved over the years. I think the implants, the technology that I have available to do that is better than it used to be when I started in this, even in training. But it's a chance to help, women at that. It's a difficult time. They have a cancer diagnosis, and there's so many different options for reconstruction, really trying to help them, give them options, and help guide them through that, and see if that's something they want to do, and help them get through that surgically.
Talk about a traumatic. I mean, that's oof.
Yeah, it's really powerful to see too what, some of these patients will have had chemo. It's been a really difficult road, even by the time they see me the first time, and then they're talking about then the mastectomy, and then do they want to do reconstruction? So really trying to be there for them, be aware of all the medical issues, and try to offer them some options for reconstruction if that's something they want to proceed with.
Well, now we're moving into a time when the world is changing dramatically with all of the GLP-1 stuff.
Yeah, absolutely. So I mean, GLP-1s, I think, are an absolute game changer. I mean, I've never seen anything like it in how it's transformed patients. And it used to be, people would have weight loss through diet and exercise, but you wouldn't see it as much successfully long term. And there were a lot of studies to sort of show that bariatric surgery was more effective than that. And so I think we're seeing the GLP-1 so powerful that people still have great success with the weight loss surgeries. I mean, it's still a great option for some folks, but the GLP-1s really offered people a chance to change their bodies, frankly. I mean, I'm seeing a lot of patients who have lost significant amount of weight. And another part of my practice is the reconstructive, aside from reconstructive, is the aesthetic part. And a lot of that is breast and body contouring. So the body contouring is taking that extra skin, and, the body has a great capacity to help contract and get rid of some of that excess, but there comes a point where it's just not going to get rid of all of it, frankly. And so some patients are just better off having surgery if they want to get rid of that extra skin. And that's what I can do, is help them kind of do a little nip and tuck and tighten things up a little bit.
And there's a real art to that.
Yeah, I mean, there's different ways to approach things in terms of the different types of surgeries available, whether it's a abdominoplasty, a body lift, breast implants. There's different things depending on what patients are looking for.
It was funny. I was talking to the other day to another person. I was talking about like closures and how they've actually, and this is like a cleft lip and palate situation. And it's like, talk to me about how, closures have advanced and over the years. And one thing that's happening for sure is like, you guys are just getting better and better at what you do.
Yeah, I mean, I think, I just have to recognize all the great mentors and teachers I had. I mean, I think that's one of the great things about being in United States, surgical training system is we have great mentors. It's just a great program with great traditions. So, I mean, I feel fortunate to have trained in that. There's a lot of great surgeons out there, and I think we all benefit from that. And the technology does get better. I mean, and I think the techniques, we're all trying to learn. I'm certainly trying to always get better and kind of hone what I do, as I think every good surgeon should be doing. And, but yeah, I would agree. I mean, I think surgery it's safer. I think the outcomes look better. So yeah, it's exciting to be a part of that.
Yeah. So out on the aesthetic side, I mean, obviously on the reconstructive side of things, patients seek you out for obvious reasons, right? I mean, that's part of the deal. But on the aesthetic side of things, people seek you out for obvious reasons. They want a certain outcome, certain look, certain feel.
Very, very different situation. And really, patients who are healthy or they've made some changes and they just want to change the way that their body looks a little bit, increases confidence. And there's different reasons why people do it. But I think that, that's a very enjoyable part of what I do as well, because even small things, I mean, I like big changes and very dramatic results, but even small things really can make a big difference with the patients, how they feel about themselves and how they look. And it's positive. So I enjoy doing that. And, I think if you kind of look at all the non-surgical options that are out there, there comes a point, especially with patients who had significant weight loss, where they're just not effective for that group of folks. They have too much extra skin. So surgery is really going to give patients a better result. And so that's where I come in to help, give them the body that they're looking for.
Yeah, for sure. So let's go back.
Yeah.
And let's talk about, you have to have aptitude to, number one, make it to med school.
Yeah. I mean, I just didn't show up here and become just don't magically one day become a plastic surgeon, right? There's a lot of steps that go into it, right?
Yeah.
Yeah. I mean, I think, kind of where I started in terms of college, how did I get to medical school? Well, I had no interest in being a physician when I went to college. I actually went to, a small Catholic college. I was interested in being a priest, actually. So they had a seminary there. And really, I spent the first probably 3.5 years deciding if that was a vocation I was going to follow. And ultimately decided I wanted to get married, have kids, and that really wasn't the path I wanted to take. And spent another 3-4 years kind of deciding where I was going to focus my energy. And that process is an interesting story in and of itself, because when I sort of looked at all the options in medicine had kind of come up, went to some of the folks at my colleges I was finishing up, and it was very discouraging because there were all the steps you have to go through to get to medical school. So I kind of knew I was up against at that point, and took about a year off. I was working, was a bartender, started volunteering in an ER at UCSD, and that was it. I mean, I had that experience, and I thought, and I'd always had a great aptitude for science. I always won science fairs. I was I was always a smart kid. I mean, I had a lot of, it was interesting because I had thought about being a scientist, being an astronaut, all these aspirations when I was a kid. But I wanted something more with people, something, especially I think from the priest angle. I just had this more altruistic idea. I wanted to do some good in the world, do something different, help people in some way. And I really didn't know how to, make that, how to crystallize that. So when I saw what people were doing in medicine, it was exciting. Like something just clicked, and I just graduated, right? So, I mean, there was a part of me that really felt a bit adrift, and I was looking for this direction. And when I saw that, I thought, I can dedicate myself to pursuing this. I mean, this is something that just seems like it's greater than me, and I really felt excited about it. So it was a question then of kind of looking at it more, and then I volunteered in the surgical ICU and then I got a job working in a lab in the hospital, became a phlebotomist, all these little things. Meanwhile, working like 2-3 jobs and then decided I was going to take the pre-med classes. So I was just, completely consumed by wanting to make this happen. And so that's kind of where it went. And then I got the prerequisites. There's all these steps, hoops you have to jump through to qualify for med school. And then I took the entrance exam, did really well, and was fortunate to get into a lot of great schools. And then I went to med school. I mean, it was my dream. But I had to be realistic. I mean, I think everyone has to think, well, what's my plan B and all that? And I had a plan B, but I just kept going.
What was plan B?
Well, I thought about law school. I have a lot of really good friends who are lawyers, and they are happy and they're doing good work. So, I mean, I actually did some kind of grunt work for a law clerk when I was in school too. And, I thought I was looking at the LSAT. And so there were some other things I was interested in. I wasn't really big into business per se. There was a lot of folks in my school that were, business majors and all that, but law seemed really interesting at the time too. So didn't have to go down that road. Things just kept happening. I mean, I think that's part of it. You have these little successes and then they all kind of accumulate into, you just keep heading in that path. And it just seemed like that's where I was meant to be.
It's an interesting concept, right? It's sort of like a series of it's a cumulative effect of success. Little things, one step at a time. You hear that out of all sorts of professions, tier 1 operators, successful business people, doctors. It's just the cumulative effect of incremental success.
Well, I think too, I think the difference between when I was doing my pre-med requirements and when I was in school is I was more focused. So we're talking about pathway to, peak performance. That's really where it started. And I think part of it was understanding what I had to accomplish. So I had very clear goals, and then I had a timeline, and I knew what I had to do, but then you have to do it. You have to execute it, right? So, and for me, the college experience was very different than my pre-med experience. And so it was more focused. It was sitting in front of the class. It was studying pretty much, I don't want to say 24/7. I mean, I was sleeping and working, but it was very dedicated to doing that. And I made a lot of sacrifices just to focus on getting good grades, studying, and I had a really good mentor. I had an advisor who gave me a lot of good advice, and she was great. And I think that was helpful too. I had to find somebody who was who had my best interest and I could trust to give me good advice along the way. But it was that dedication and sacrifices, I think, where it started, and long hours, and then realizing too that I had to work through school at that point, and so I had a couple jobs, and it was just that I was hungry for it, and so I had to spend extra time. I mean, just everything I did was just dedicated to doing that.
Not everybody is that way.
No, but I think I just realized I think I just felt such great potential when I was younger, and I think when I finished with college, I thought, I have a lot of undeveloped potential in a way. I don't know if I looked at it exactly like that, but I really felt like I really want to do something with these skills I have. And I just didn't know the direction. And, I prayed about it. I did a lot of, I went to the ER and did a lot of volunteer work to see. And once I really knew that's the direction I wanted to go, I was just all in.
It's interesting. Do you feel like there was somebody along the way that was helping you? I mean, or were you
Well, I
just...
mentioned my advisor. She was really good about, Dr. Lewis was great. She gave me kind of the timeline and helped, basically said, if this is this is your goal, you want to go to med school, here's what you do. Here's the timeline and just do it, and I did it. I did it to a T, and I was on it. There's no slacking, I had roommates to be throwing parties, and I'd be in there studying my organic chemistry, on a Friday night. I was living at the beach, but I was able to focus and just, it really was sacrifice. I don't think I looked at it so much like that at the time, but I just knew this is what I wanted, and I was going to fight for it. And I had, a lot of good professors along the way, but, I had to do the work. I mean, that was the thing. Yeah, it was a lot of work, and it was a lot of late hours, and there is a great degree of sacrifice, I think, that comes with doing these types of things. I mean, you have to sacrifice something.
Yeah, and then you transitioned.
Well, it was medical school, and that was in medical school was a tremendous experience. I mean, I was actually here, UCSF, across the bay, probably best experience of my life in terms of the culture of excellence. And I think that's where I really got that taste of, here were really the smartest, most capable people I'd ever been around. And they were the top of everything, people that were getting, valedictorians. They were the people that were just, the tops of every school. I mean, I can rattle off all, the schools in the Bay Area, Berkeley, Stanford, I had a roommate from Harvard. I mean, these were people that were just extremely bright. They were talented too. And weren't just bright on paper, but they had emotional intelligence. And so that was a great milieu to be involved in, because I think it really raised me up in a way. I mean, I learned so much. Speaking about work ethic, and these are people that were just zealots about, for the most part, everybody has their different pathway to success, but I just saw how committed people were to just being just better than average, not settling for mediocre. There's a way to do it more. Can you answer that question before going to seek the answer from somebody else? I mean, there were just all these different little things I learned, and just from seeing directly, whether it was in the classroom or on the rotations in the wards, in the residence. I mean, it was just tremendous. And I think it instilled in me this idea about excellence, and that I wanted to pursue that, whether it be writing a note for, a patient interaction or doing a surgery, just everything, trying to do the best I could and strive for that. And that carries through to residency, the 2 residencies I did.
Yeah. So talk about those if you would.
So as I mentioned, I wanted to go be a liver transplant surgeon. I thought that was extremely exciting. I had some great experiences with that. My advisor was the chief of transplant surgery, later the chief of surgery, and it was just tremendously exciting, and I really enjoyed that interaction. So I finished medical school, went up to general surgery, and I enjoyed the work, but it was kind of a lifestyle. There was definitely some of that, and because I had a chance to see, like, wow, this is what it's going to be like for the rest of my career. And so I began to look at other sort of branches of general surgery. So, and this is kind of an old-fashioned model, but you train as a general surgeon, and then you can become a heart surgeon or a vascular surgeon or a transplant surgeon or a plastic surgeon. Now they have these more integrated models where you kind of do it all together at a med school, but this is, kind of the old track. So I was looking at, what direction I want to take. So plastics was definitely not on my radar. But when I had a chance to kind of see what they actually did and mentor and, follow the one, particularly Wayne Ozaki, who's actually the chief at UCLA now. So he was really excited for him. He was a tremendous, just seeing, his level of skill and how he interacted with the other surgeons he worked with. And I just like the collaboration, I mean, usually, especially if you're doing reconstructive surgery, there's a lot of collaboration with other surgeons. So you get to work with really bright people in challenging situations. And so I did that, and then decided I wanted to train in plastic surgery. So then I was fortunate to go to UC Davis, so not that far from here, and spent a few years just doing a tremendous amount of training across a broad range of things. And had always been interested in craniofacial surgery. So that was something I was initially interested in, and decided not to pursue that route. And then went back up to Portland, got invited to join a couple guys up there that were in practice, and, the rest is history.
Yeah. Portland's a great place to live. I mean, it's such a...
You're an hour from the coast, you're out from the mountains. I do a lot of stuff outdoors with my boys, go mountain biking, surfing, motorcycles. I mean, there's a lot of things that you can do outdoors there.
Yeah.
Kind of hard to leave.
Yeah. I remember going to Portland the first time and just being like, wow, as a San Francisco guy, I was like, wow, this place is really cool.
The spirits, the outdoor part of it is exciting. I think that's why people like it and stay. I mean, and I think I did more things outdoors the longer I was there. So more fishing and more hiking and more stuff outdoors, because it's a nice place to be, and people were very pleasant. I mean, I think that was the thing I noticed when I kind of went there, is how nice people were generally. I mean,
yeah,
it seems genuine. I mean, I think it is genuine, but
yeah, I mean, it's interesting. You talk about the outdoors. You like challenging things. You're Casper, Wyoming. Talk about the cycling.
Yeah, we were just chatting about that. So, I grew up playing team sports, and I think that was good too. I think a lot of the lessons I learned about working with others and some of those challenges, leadership, was from playing football, playing soccer, playing basketball. But I knew I wasn't going to do that forever. I knew I'm not a college athlete, or at least for those sports. And so I had a chance to see a bike race in Casper. It was Casper Classic, was just this stage race. And it just seemed really exciting. And these guys seemed like they were pushing themselves to the limit. And I'd never really done any individual endurance sports. And I just thought, man, this looks really interesting. And I like the idea of pushing myself. It was just a time in my life where that was just something that was really attractive to me. And so I started riding my bike in the middle of the prairie, got a road bike. And then one of the reasons I liked San Diego, where I ended up going to college, was that they had road racing. So I was on the cycling team, and we'd travel around to other schools and would race, here at Stanford and UCLA. And so it was good. And it's been something I've kind of taken up again in middle age. I got away from it for a while, and it's been the best thing ever. It's definitely part of my pathway. I haven't really talked about kind of things I do now, but that aspect of physical activity and endurance and, kind of some degree of physical suffering, I think that has been, something that still is, I find helpful and enjoyable. It drives me, yeah.
So you're a father. There's a pathway to peak performance in being a father, isn't there?
Yeah, absolutely. I mean, I think part of it is we only have so many hours in the day, right? You got 24 hours in a day. Where am I going to spend them? Who am I going to do things with? And, for me, my kids, that was a big thing. Even looking at what I was going to do after plastics residency, I was going to do some more training. And for me, there came a point where it was, do I do the next fellowship and do yet another year of training, or am I going to spend it with my family? For a while, I struggled with that. And at the end, I'm like, I need to be there for my boys more, or it was my one son at the time before my second son was born. But, we have to make decisions, and so it's not necessarily, binary, but I wanted to be more flexible to be able to spend more time with my kids. And so for me, the choice was, do I go into academics, or do I pursue this route where I was going to be even more focused on my career, or was I going to have more time to be a husband and a father? So that's what I chose. I think it's about values, and I just decided for me, and a lot of it was wrapped up in pride, frankly. Looking at big institutions. Frankly, I had a fellowship lined up, and when I had an experience, I think I was telling you about what happened in Nepal. It just changed my life, frankly. So I decided that I was going to I was going to do a whole different path.
Yeah, I think now that you bring up the Nepal story, you got to tell that story. That's a crazy story.
It did change my life. So when I was in residency, my last year, we had opportunities as residents to go do medical missions, service work. So you do usually a lot of cleft lip and palate surgery, or you do burns. There's a lot of different things, but in a different country. So there's a group called Rotoplas, which is a great organization, kind of based in San Francisco, actually. They had a trip going out to Nepal, and it was their first one. So my mentor at the time, Granger Wong, I went with him. And so we went out with a group, and there were a couple other surgeons, another surgeon from the Bay Area. So we had a great week doing cleft lip and palate and burn surgery, and some hand surgery too. And it was tremendous. It was, they would, patients would get sort of recruited, and then they would literally take buses or walk for, miles. And they would, we'd see them do surgery, see them after for the aftercare. And it was just, it was incredible. It was really, you think about all the good you can do. And that was just such an amazingly positive experience, because some of these poor children had, cleft lip and palate. A lot of them are just incredibly ostracized. In some cases, they look at it as some moral failing. It was just this awful thing. So you can really make a difference with them socially too, not just physically. So that was a tremendous experience. At the end, we had planned to do some traveling. And one of those trips was going to go, we went up to the Mount Everest base camp. So we were in Kathmandu, and then actually a small hospital just south of there in Benampa. And one of the surgeons had a contact at the airport. So we went up, a couple days in a row to see if the weather conditions were good. So at the time, you couldn't get a helicopter up to Everest. So the only people that were flying were either rescue helicopters or it was the military. So we were up with a military, there were a couple guys who were pilots up there at the airport, literally. And, it was, you pay them, and then they were looking at weather conditions at the, Luklas, the airport, which is at the end of the Khumbu Valley. And then you fly there, and then you take the helicopter up the valley to the base camp. So finally, I'll get the good weather. So good weather. So we're in this rickety old helicopter that was apparently a gift from India to the Nepalese army. And so it's myself, an anesthesiologist from England, Dr. Wong, and then the two pilots. And if you look at this helicopter, it looks like it's about ready to fall apart. I was just excited. I was like, hey, we're going to Mount Everest Base Camp. It's going to be great. We'll go for the day. And that was kind of the idea. And we literally had planned out, we were going to go to southern Nepal, which it's an interesting country because it has in the south is like jungles. So we had already made reservations for this jungle tour. We were going to hang out, this place where there's tigers and, elephants. So we had all this planned out. Well, we basically, it's an amazing view. So you're in this little helicopter and we fly from Kathmandu in the helicopter to Lukla. And so you go through the part of the Himalayas to get there. And it was spectacular. I've lived in, the Pacific Northwest, been around mountains, but and lived in Wyoming, and you've got the Continental Divide. But this is like on a whole nother level of just awe-inspiring natural beauty, right? And along that way, we go over these like ridge lines of snow, and you can see people walking around. You just realize how fragile you are. You're just up there in this little helicopter, right? And it's interesting. At that time, as we're flying over this, I'm thinking of a friend of mine who I went to college with. So he was in the Marine Corps, went to do some work. He was an FBI director at a regional office for a while. He's just a tremendous human being. But he had an experience where his parachute malfunctioned. And on the way down, he's thinking about things, and he told me this story. And so he's like, if I survive this, I'm gonna change my life. I'm gonna do something different. And and for him, that was really about more of a religious, he's a pastor, and it changed his direction. So he survives. He hits this roof, and honest to God, he survives this thing. He's been moved up, but really without a scratch. And I just thought it was the most amazing story, right? So I'm up there flying over these things going, what if we crashed? What would that be like? What would I do different, maybe? What if I had a chance to, and I'd like to think I was still trying to be a good man, a good husband at that point, a good dad, but I thought, man, I do even better, if I had another chance, like if I was literally gifted, like more time on this earth. So fast forward, we get to Lukla, which is, dubbed the most dangerous airport in the world, right? Because there's a lot of crashes there. So the helicopter comes in, no problem. And then just because of weight and because of the atmosphere, you can only have so many people in the helicopter, right? So they go, hey, we're gonna fly up the valley, we're gonna drop people off, and we're gonna shuttle you guys up to the base camp one at a time. So great. So we go up, and Jock, it was amazing. Like I never really seen a glacier like that before. So you get further up, and you see the glaciers right there, and you're flying over really these ice fields, and then you're looking at it's like a postcard everywhere you look. It's just spectacular, and it was just awe-inspiring, and you can kind of see Everest in the distance. And then you kind of snake around the valley. So we landed, and there's all these little farms. And I was fortunate that, hey, I get to go first, right? So it's just me and the two pilots. You get in there, and then we're flying up next to the glacier, and I'm taking pictures with my little teeny 8-megapixel camera. This is 2008. And so base camp is really just in the rocks. It's really not that much to look at. It's a bunch of tents. And there's mountains around there, and it's around, say, 17,000, 18,000 feet. So it's pretty high. We're circling, and it's really noisy. There's not any, I didn't have a noise canceling, headphone. The pilots did, but it's just the nature of the equipment. So they go, it's just too windy. We're going back. We can't land, right? And I'm like, hey, this is great. This is really exciting. I got to see, Mount Everest is right there. This is spectacular. And within a few minutes, though, it became obvious that we were going down. And I don't know if it was the lack of oxygen from being at that altitude, but I was kind of like, this is weird because we're not supposed to be landing on this mountain over here. And really, it's about 18,000 feet. I want to say give or take, but it's called Kala Patthar, which is this little, looks like kind of a hill, but it's really high. And it's right next to the Everest Base Camp. And it happened really fast. So I didn't have a chance to really think about that, but we just literally lost power. Basically just slammed into the side of this thing and, overturned. And I just remember thinking, oh my God, am I alive? And I was just like, thank God. So I was upside down in the harness, so I unstrapped myself, and the pilots had been banged up. They were kind of bleeding and banged up, but we were all able to walk out and survived it essentially. So I had a satellite phone. All the electronics were destroyed, so we used the sat phone to call the base, and they sent another helicopter up. We had to hike down, and from there were these guys that then hiked up. So we were going over the valley, and this group of trekkers had seen us go over, and they heard us crash. So this Dawa Sherpa, who's now a friend of mine, I still keep in touch with Dawa. He has a guide service in Nepal. He was guiding this group from the UK up, and so Richard and him, hiked up the side of this of Kala Patthar, which is a pretty steep grade, and then helped us, basically helped get us down. Got some first aid supplies for the pilots, and it was and ultimately helped us get kind of out of there safely, because we were going the wrong direction initially. We were going towards the cliff where it was, kind of a drop off, and they were like, no, you guys want to come down here? Went to the glacier, hiked down to, I want to say Gorik Sheps. There's a little kind of like village that's the last village before you get to the base camp. And so that's where we waited for the other helicopter that then took us back to Kathmandu. But my light didn't start flashing in front of my eyes until I was hiking down Kala Patthar. Honest to God, I mean, I was walking down there, and I mean, all these things, the birth of my son at that point, getting married, high school, childhood, and it was, I just remember that it was really powerful. Like, I don't think I had time when it was happening.
Was it like a delayed effect, you think?
Yeah, I mean, I didn't have time to think about that, but it was definitely like, I don't know if it was the adrenaline, but it was definitely like all that just kind of came rushing up as I was hiking down. Yeah, it was interesting.
Wow.
Yeah. So that really kind of made me think like, wow, I survived this with relatively minor injuries. I mean, I went to the hospital later, but I got checked out. I was fine. But it really made me think. Like, wow, I felt so fortunate to have survived. And especially since I was thinking about what was going to happen if I crashed. I mean, it's just odd that I was even thinking about that, before. So it took me a while to kind of put that together, but I had a position lined up in Boston, and it was going to be another year of training, and it was, honestly, it's just too much for my family. And I think I was trying to put my own interests ahead of my family's. And I remember there was a day when I'm back, I'm in residency, and now I'm kind of deciding, this is in the spring before I'm supposed to go. And my son was it wasn't quite 2 at the time, but we were watching the clouds and jumping in puddles, and I thought, there's no way it's going to be about my son and my wife. And at least for me, it's a different direction. Now there's some people that they do the research, the clinical, they teach, they call it the triple threat, right? If you're in academics. And I just decided, that's just not for me. And for me, it was like, my wife and my son, that's more valuable, and this is the route I should take. So for me, it meant I'm going to go to Portland, and that's where I come from. So I trained up there, and go back, and at least that's where it was going to start. And so that's where I just decided to take a different route, and best decision ever. It really was, because I think I realized that, it's just about values, right? I mean, for me, it was realizing what my values were, so I had to get those in order. And you'd think, well, didn't you have those in order before? But, there's competing interests and my own pride. And I was like, my marriage is more important, and my son is more important than my career. And at least for me, I had to make that, change. I mean, maybe for other guys, it's different and it all works out in some way. But for me, that's where it started. And I think I've been able to kind of take that and still try to excel with where I'm at, in terms of my practice, but in a different way. And so for me, it's all been about, clinically, it's not teaching and doing research. It's really focusing on the art and science of surgery and how I do it, on a daily basis. So that's where
yeah. So much of that is reps also too, right? I mean, you've done a lot of surgery.
Yeah. I'll be 10,000. A lot of surgeries. Yeah. So, they talk about 10,000 hours to be an expert. And I think I passed that a long time ago. And
I think at the end of the day too, from a surgical standpoint, talk to Mike Longacre about all the research and stuff that he's done. And, We've talked about him extensively.
Yeah.
But
Yeah. Yeah.
phenomenal. I think in the surgery game, after being around it for all these years, it's really like you see like, surgeons who really are getting those reps, getting those cases, you're doing so much. You said that 10,000 hours. It's like, you think about it, and if you've done 1,000 surgeries, you're pretty proficient, but it just keeps getting better and better, doesn't it?
Yeah. I mean, thousands of certain techniques I've done. I mean, or just certain individual surgeries. I mean, yes. So I think I think repetition and experience definitely matters.
But it's also a passion for an outcome, right? Isn't that true? I mean, we can't speak about surgeons on a whole, but what we can do is we can talk about your passion for an outcome, and knowing you literally, like, you have a passion for
Well,
getting the right outcome.
Well, I always plan things with the idea that I want the best result for the patient, and I want it to look good. I want them to do well. I mean, there's that, I've invested interest in it and I care about it. I mean, I think that helps. I mean, I think that's what, drives me. So every individual surgery patient, I mean, I really look at that like I'm going to focus on that during, that particular time. And I mean, I think that degree of concentration and I mean, I think it makes a difference, when I focus on something for like.
It seems like that's a continuous theme for you, is that whenever you do something, you focus in on it, you get locked in, you stay focused on it until you master it.
Well, I think as I've gotten older too, it's like, how do you maintain that so that you set yourself up for success in terms of, take care of myself physically. I mean, I have a routine I go through. I mean, all these things. I mean, there's definitely a mindset, but there comes a point when you have to, take care of yourself to set your body and your mind up for success. I mean, that's definitely part of it. I mean, that's a big part of it, frankly, as I get older, to be able to repeat the successes and it's, creating these, it's successful habits, it's a routine, I mean, my routine, I pray every day. I have my constants. We talked about constants, right? So for me, it's, part of that's spiritual, part of that's physical, it's taking care of myself, it's working out, it's dedicating part of my day, part of my week to each part of that, of my being, to care for myself in some way so that I'm optimal, so that when I have a patient or someone who's sick or that wants enough, to improve their body and their shape, I'm there able to do that, optimally,
Yeah.
I think there's, for me, that peak performance is taking care of myself and being on the top of my profession in terms of like looking at what state of the art in terms of the techniques or the technology or the surgical equipment. I mean, there's just a lot of different moving parts to that, but it starts with me.
Yeah, that's never ending.
No, I mean, and I think that's what's exciting too, is that it constantly changes and it really gets better in a way. And in some ways it gets easier because you do the same thing to a degree, but then you're like, how can I get better at it? How can I do it faster? Or how can I do it with fewer steps? How can I how can I improve the patient's experience so that, they either, less discomfort post-op, easier recovery. I mean, there's just so many things. You're trying to improve that whole process. And so I enjoy that. I mean, and it's a challenge. There's always some way to approach that. So whether it's enlisting others or, definitely I look at, so every time I do a surgery, I always take notes. I learned that early on. So, most cases, I mean, a lot of routine things, I don't necessarily do that as much anymore. But if there's, I try to learn from each surgery and think about, okay, I kind of debrief myself, what can we do different? How can we improve that process? So, I mean, I think that is definitely part of what I continue to do in terms of trying to improve outcomes and be a better surgeon. Because these are the things that aren't in the textbooks or I mean, you sort of learn them in residency, right? Improving, but ultimately you have to take ownership and charge of it and do it yourself. And so it's just a regular basis. It's not being arrogant or not being, cocky. Do you have everything all figured out? It's trying to continue to get better.
Yeah, it's exciting. And I think it's true. Like the evolutions of that are, you have a choice to make. You can either make it hard, you can make it easy. It's just your attitude about how you're going to handle things and how you're going to move through life. There's a lot of inertia for a lot of people. They don't want to change. But if you're excited about change and going to that next level, it can be pretty interesting and actually exciting, right?
Yeah.
Yeah. So, young surgeon or someone that's interested in being a plastic surgeon, where do you think plastic surgery is going to be in 10 years from now?
If you look at it, I think the technology may change to some degree, but I think in a lot of ways, what we're doing on a day in and day out basis is going to be similar. It's just that some of the techniques may continue to change. Some of the the instrumentation, AI or some of these things from microsurgery in particular. So different. I think it's going to depend on the type of subspecialty of surgery. So if you look at what's being done, the aesthetic surgery gets a lot of the press. I mean, that's what's big on social media, a lot of the TV shows around that. But really, there's a lot of plastic surgery and the reconstructive surgery that no one knows about. And I don't want to say it's behind the scenes, but it's the kind of things that aren't as glamorous, but it's the things that are happening every day across the world to help people put their bodies back together. And so I think those techniques actually continue to improve too, because we have better understanding of anatomy, blood flow, and I do things, some new techniques that I've learned even in practice to have better outcomes and reconstruct things better than I could 10 years ago. So I think we're going to see all that. I mean, I think technology plays a role, and it's just a question of, how you fold that into your practice, um, imaging. I mean, there's just a lot of things that help me. At the end of the day, though, plastic surgery is still about using your hands to do a surgery. You have to assess the patient. There's analyzing what the issue is, coming up with a plan, and then executing it and, shepherding them through that whole process.
Yeah.
So, and I think we can come up with better ways, too, for that patient experience. I think patients do better with anesthesia. I think the post-op recovery process has been honed over the years, and I think it's only going to continue to get better. I mean, I think recoveries will get hopefully a little easier for patients. I think nutrition and the role of that, or even peptides, we've talked about this. What other things can we do in the perioperative period to help patients optimize their healing, their nutrition? So I think all these things are just going to be additive. And I think that hopefully patients' experiences will continue to get better as we refine a lot of these things over time.
Yeah. I think it's going to be really interesting to see how peptides play a role. I'm with you on the nutrition side of things too. I think the diets that people are eating are changing. Things are changing, and it may take a while, but I think at the end of the day, it's going to be interesting. I'm curious what you think about where stem cells are going to play a role
Well,
in plastic surgery.
Well, that's a great question, and I think it's to be decided. So that was one of the things I actually looked at doing when I was in training. So I spent a year doing research in a lab at OHSU on adipose stem cells. So these are stem cells that come from adults. We actually all had stem cells in different parts of our bodies. In particular, there's this population that kind of lives in the fat of our bodies and helps make new cells. And, they're kind of become multipotential, pluripotent to some degree, where you can expose them to different growth factors to get them to, say, turn into cartilage or bone. So that process is still being refined. I think it's incredibly exciting for things like, joint health, brains. They've looked at cardiac muscle repair. So in terms of plastic surgery, I think we're going to hopefully see how those things may help retention of, say, fat grafts or wound healing. So, I mean, that's kind of a less sexy side of plastic surgery, is the wounds and getting people to heal these chronic wounds, maybe even without surgery. But how can we get stem cells to help repair, the environment that's been damaged? Yeah, and I think it's a very complex issue. I mean, people have been looking at this for longer than I've been in medicine, but I think it's exciting because I think we can see things that can be corrected without surgery, or we can heal things, or we can optimize them. So I think there's certainly a lot of work going into this, whether it's for aesthetic medicine, how to improve the quality of skin, treat wrinkles. A lot of it's looking at wound healing. Tissue engineering is another part of that too, for creating or growing organs in the lab, or growing an artificial breast or an ear. I mean, that's why I was really excited about plastics when I spent that year in the lab, because I just thought, this is amazing. We're just on the cusp of all these really exciting developments, and a lot of them have yet to be realized, but I think it's exciting. I think just being in that environment, it's exciting.
Yeah, it's super exciting when you think about, I mean, like, let's go to, like, you're talking about those people that you're seeing in on those mission trips, and burns, the notion that you could regrow skin in the lab from stem cells and actually, do a skin.
Well, they have that to a degree with spray-on skin. I mean, there's a lot of things, temporary skin substitutes. So there's a lot of things like that where it has very practical applications. And I think they're just going to continue to refine that and make it easier to do, because I think there's a lot. It's fairly labor intensive in terms of how the cells have to be cultured and grown up. And I think it's continuing to improve for the burns population. But I think, again, it's going to continue to be refined over time.
So back to the pathway to peak performance.
Yeah.
What's next with you? I know you're doing a lot of things right now, but what's the next big thing?
Well, the next big thing is just trying to deliver a better, this is more sort of practice management sort of stuff. I'm always trying to look at, right now it's, as a new type of implant that's out, utilizing that in my practice, some new techniques using like an internal bra. There's all these different things that I've been working on over the last few years.
What's the new implant?
It's called Motiva. So it's a brand that's been available, in the rest of the world for the most part for many years, I think about 14 years. And it just got approved in the US. So it's got some different characteristics in terms of its production. It's like 6th generation. So there's some characteristics of it that make it a little different than the current implants we have. And the safety profile, at least historically, has a little lower rupture rate, a little bit less scarring that forms around the implants. So I've been putting more of these in, and I'm excited to see how they're going to do long term.
Interesting.
Yeah. So, but, for me in the practice, it's, I realize like I can do the best surgery in the world, but a lot of that also has to do with the patient's experience too. So it's really trying to be a good leader. It's trying to be a good example in my office about being conscientious, taking care of patients, and then also trying to make that experience streamlined, comfortable, so that patients feel taken care of, and really trying to continue to improve that. I think that's, it will always be something I'll be working on in terms of improving that. But that's kind of been my latest focus is patient experience in terms of when they, come meet everyone from the folks at the front desk to, the back office. My MAs. It's just all part of that process, and surrounding myself with good people. I have a PA, Rachel, who's just fantastic, and she's part of that too. So you have to find people that you trust that can be part of an extension of yourself in terms of how I care for people. Not just continue to refine my own skills, but also the practice as a whole.
Yeah.
So that's what I'm doing. And just looking at ways to improve patient education, the patient experience. Because I think at the end of the day, patients want to come in, have their problem addressed. They want to have it disrupt their life as minimally as possible. And they want to feel as little discomfort as possible and have a nice outcome. So delivering that, there's a lot of moving parts to that, but that's where my skill, my expertise, my experience, it definitely helps to guide them where I think they're going to get the best outcome and be happy with it. Or in some cases not, or look at some other options. This is not a matter of selling patients surgery. It's trying to find out how I can best help their concerns or problems, and then giving them a realistic idea of what, I can do for them and kind of the best way to go.
Yeah, I think, that's the one thing. I'm so glad you brought that up, because there's like this ethical component. And I know the way that you practice, right?
Well, that's a good point. Yeah. I think it's a mixed blessing that I was never really that interested in business, because I try to look at the interactions as more, as a doctor taking care of someone, whatever their problem is, whether it's cancer or it's a tummy tuck, I'm still doing kind of the same type of thing, but I try not to make it transactional. I guess I just don't really enjoy that part of it. So I don't look at it like somebody has to come in and leave with a surgical plan all the time. Some people, maybe they don't need surgery, or maybe they have some health issues that need to be addressed before we do that. So it's really trying to be a good doctor, frankly, at the end of the day. That's what I'm trained to do, and not just be having people signed up for plastic surgery. It's,
yeah.
And I really think we're all trained, as I say, we as surgeons, are really, they try to instill in us those sort of ideals or those values as surgeons. So, I look to my mentors throughout the years. So it's not like I just kind of came up with these ideas in a vacuum. I think I had a lot of good examples of people who were conscientious and were good doctors, good surgeons too. So, I mean, and I've tried to emulate that and do the same thing and carry that on. I mean, I take great pride in that. I mean, I feel like I'm part of something bigger when I do that. I mean,
Yeah.
I feel great responsibility for being a surgeon.
Yeah, I think it's also, I mean, trying to manage patient expectations too. Sometimes people, they have this sort of illusion of, I would imagine, I mean, that must be tough.
I think it's true. And I think that the internet, social media, tremendously powerful. I mean, I was just talking to somebody about this the other day, how we still for the most part looking at cart catalogs, even in medical school, right? So now it's tremendous power, on the plane, I'm reading like journal articles, I can look at stuff, I can continue to be up to date and learn things at a speed that was not possible 20, 25 years ago. But at the same time, I think people are exposed, especially social media, to potentially things that aren't realistic in general or that aren't really fair. And so I think that can give people a false idea of kind of what's healthy or beautiful or normal, or those things can need to change. I mean, beauty's, there are some objective things we look at in plastic surgery about, how do we measure beauty, but there's a tremendous subjective component to that too. And so yes, it can be difficult. So I think that I try to put things in perspective. So if I see someone who has an expectation that isn't realistic, I try to explain it, just to kind of tell them what I can and can't do, I guess.
Yeah.
And I think part of that's just knowing, what the limitations of surgery are, not overpromising things too. I don't think that's fair to patients. And because I think sometimes people see things, and I don't see too many of those folks that come in, say, hey, I want to look like this movie star or something. But at the end of the day, it's about doing the service to the patient. And sometimes that means telling them, here's what's more realistic given, your health or your body type or things. And then we go from there.
Yeah. So one of the things that is kind of interesting, I always try to talk to people about, is flow state. When you're in that kind of state where everything is just sort of like going, right? You're at that peak level and it's almost like you're in a mode where you don't have to really think about too much. You're just doing it. Does that happen for you in surgery?
Yeah, it really does. And, kind of thinking about it, usually I'm working in a pretty small space. It can be a few square feet, maybe a body, but I can be working there for 2, 3, 4, 6 hours. And there's definitely points where, it's just kind of timeless in a way, but I'm just focused. And I think part of that's just, I think my temperament, I've always been someone who could focus on, a task for a long period of time. But I think it's also trained, I've been doing it for a long time. But it just, when things flow, and part of it is, there's certainly decisions that I have to consciously make, but a lot of it is just having done it. There's part of the training and the inherent, we talk about muscle memory in surgery, and but I think it's definitely something, and that's what I enjoy. Like after a good day of surgery, I can feel like, yes, I operated for 8 hours and it was just, you're sort of in the flow, in the zone. I mean, it's, I think if I couldn't sit still for that long, I wouldn't be a good surgeon.
But you think about it, if you go back to the fact that you could focus the way that you could in order to study, we talked about cumulative success.
Yeah.
Like,
It's all those things are additive. It's training. I mean, you just don't show up one day and do surgery for 8 hours. There's all these little steps that kind of, all these experiences and practice and the training and having to be an assistant, so you pay your dues for years. I was a resident for 8 years. That's a long time, but you get to learn a lot during that time. And you also see what a profound responsibility you have as a surgeon. But, and I think I just appreciate that at the end of the day, I can spend hours, and I think it makes me, I think from a technical standpoint, better because I can focus on just trying to continue to refine the steps and be a better surgeon. And there's definitely something to that,
do you ever walk out of the OR and go, whoa, like what just happened? Like the time just went by like that, or are you conscious of it the entire time?
I'm always amazing. It doesn't feel, like sometimes, like you're waiting for the flight to go and you're like 10 minutes seems like an eternity. And, I can turn around 3 hours later. I'm like, wow, that was, we're at the end of the day. It's like it's like 5 o'clock and I'm like, man, where did the time go? We've been in here operating all day. And so I definitely think there is something to that in terms of you kind of get very focused on it, the task at hand. And there's something kind of timeless about that. I mean, I mean, that's just definitely part of it.
When you scrub up, when you're going in to scrub up, do you have like a routine, like a checklist that you're going through?
So I do. And frankly, I've already looked. I mean, I look at the case, look at the patient. We go over these things before what I'm doing, the surgical plans. I'm thinking about that. Honestly, so, I'm always, so I learned this from another surgeon, I always, pray for myself to do a good job, take care of the patient. So I really try to do that in every case. But I mean, it's really trying to mentally prepare myself and then it kind of walk it through. Jean-Claude Keely was a Olympic skier. And so he would talk about skiing the course before he would race in the Olympics or down giant slalom or whatever. And I always thought that was interesting. And so like one of the things actually I learned or I was really interested in was this mental training. So I remember doing that with cycling and, doing it for soccer, but this idea that you could walk yourself through. And the thing about sports is it's so unpredictable. With a surgery, I can go through and I can do the surgery in my head or have gone through the steps. And so it's kind of a fast forward edition of that, sort of plan like, okay, what am I going to do? So I've already done the surgery mentally before I go in there. Visually seeing myself or seeing the steps and the time. And I think it makes things more efficient. I mean, where am I going to put my hands? What am I going to do? All these little technical things that come into doing the surgery before I'm actually there and and then realizing too, that there's some gaps in there. Like, okay, how am I going to do that a little differently this time? Or what could I do to be a little bit more smooth with that, and I like that aspect of it because it's just my two hands. I mean, that and there's more to it than that, but
Well, there must be something also kind of interesting in the sense that it's kind of like remodeling a house, right? You kind of don't know what you're doing until you're in the walls.
well, yeah, that's funny you use that analogy because there's some plastic surgeons I know that use that. I'll use that once in a while that, I do a little plumbing, a little electrical work, a little resurfacing, but I mean, that sort of downplays it a little bit, but, there are situations where, and usually it's more on the reconstructive end of things, where I'm kind of waiting for, say, the cancer surgeon or the other surgeon who's doing the cancer surgery to kind of leave me with the defect. I have to fix it. So I have to usually have a few things in mind in order to make the best of the situation. So sometimes I do have to make things up. It's not very often, but one of the things I liked about plastic surgery is being able to think on, one's feet. So I think I've gotten, pretty good at that, So, because occasionally I get called in to help another surgeon in the middle of the day, and I remember a case comes to mind where they had some difficulty closing this abdominal wound and I was operating and they asked me to come over and I was just able to scrub in. And it's one of those things where it's literally the patient's asleep. They can't really, you're there really in a difficult situation to help. And I was able to do some things kind of rearrange the tissue in a way where it could get it closed and worked out great. Being able to kind of be adaptable and, not be afraid of that.
Yeah. Well, we talk about peak performance. I get the sense from you that you never really feel like you always are looking for the next level, but you have been recognized in.
Well, I feel fortunate to have been recognized by the doctors in Portland. And, I think as we get further along, those metrics are different, right? So, I mean, I think it's a tremendous honor to have other doctors, sort of recognize me. I mean, I'm not the only plastic surgeon in Portland, but I mean, I've been recognized as a outstanding plastic surgeon. And I think that, and I've really tried to do, you learn these things as a resident, you try to be, as a consultant, you try to be available, amiable, and able, So, I mean, I've always tried to really deliver good care, for the community. And I think I've made a positive difference in the community in Portland. I mean, I've really taken great pride in that and been a part of that for now almost 20 years and 18 years. But I think, I think that work has been recognized and I'm proud of that. But that aside too, trying to just strive for excellence. So it's like continuing to try to do, the best. And those things it's hard to, what does the best mean? But really trying to give better outcomes and my best effort and try to do a little bit better each time.
Yeah.
So, I mean, I think having just that attitude, like I'm not done, or I haven't figured it all out, always trying to do better. And I think really it's being around people, like when I was in medical school, residency, my colleagues now, I mean, just being around, that's the milieu of the medical field too. You have very bright people that are really trying to that are at the the top of their profession. I mean, I think medicine attracts a lot of very bright, capable people, and it's nice to be a part of that culture, that community, because it makes me a better doctor, a better surgeon for sure. And I really enjoy that, enjoy those interactions. But I mean, I think that's that's the attitude I have. I mean, I think I just feel, and I tell you, it really does go back to that experience I had in Nepal. It's like I feel somewhat of an obligation. I mean, I'm like, I really feel a gift, like I'm still alive. I really feel like that was a tremendous gift. I feel blessed to have survived that. And so I feel like I want to give it all I can and do the best I can and not leave anything, like in cycling, you say, leave it all on the road. I don't want to leave anything on the table. I want to just go all out, do the best I can. And then when, my practice is over and I'm retired, then I can hold my head high and know that I did tremendous work and do my best.
Yeah. All right. Well, on the way out the door here,
Okay.
let's talk about how do you decompress
Yeah.
from a job that's pretty intense, man. I mean, let's call it like it is. There's a patient that's asleep on the table. You got an anesthesiologist there, but they're asleep on the table and you're operating. I get it that over time, it probably doesn't affect you as it did the first surgery that you did, but there is this effect that it does have. How do you unwind? What do you do? I mean, beyond the obvious of,
Oh, I spend time with my kids. So I try to go for a walk the dog with my wife every day. Try to do that. I exercise on a regular basis. I have kind of a prayer and reading. So I read, actually. I read whether it's something spiritual, political. I mean, I try to read because I like that aspect of it, whether it's online or books. I mean, I read good old-fashioned books too. But try to read something that's going to make me a better person, a better man, better surgeon. I mean, that stuff is enjoyable. But I spend time outside, and for the most part, being a dad, and especially with two boys, we go mountain biking, we go ride dirt bikes, we go backpacking, we go to the shooting range, we do all these things that are fun, that I think are exciting. But I get to do stuff outside the operating room that I'm just grateful that I'm alive and can do. So I mean, getting outside is probably the biggest one.
Yep.
And riding my bike. I mean, that's a big thing too. I've always loved riding my bike and being outside, and I go fishing. I have a lot of outside interests, but I think, part of that peak performance too, for me, is having those things to do. It's just not all monochromatic. I mean, there's got to be some fun. There's got to be some, getting away from that environment for a while to keep it in perspective. So I have to take some time off, even maybe I don't want to do something that's going to be restful. Be good for the soul. And that's why it's been nice to be in Oregon. I mean, I've been other places and done some adventures, and like, my son and I just went scuba diving at the coast last week, which is a rig adventure in the cold water. So dry suit diving, it's very challenging. The visibility is usually kind of dicey, but it's just the adventure of it, and I enjoy doing that with my son because it's challenging. We're going and doing things that are difficult to do, and there's kind of that excitement of getting to see things that other people don't get to see, under the ocean, go diving or spearfishing and all these things that I've, kind of enjoyed doing and outside here.
Yeah. Well, you've worked hard. You've had a great career to date, and you're focused on the future and continuing to head in a positive path, seeking excellence. You're definitely on the pathway to the peak performance continuously, which is cool. It's cool. I really always enjoy spending time with you.
Well, thank you. Yeah.
Yeah. So thanks for coming in.
Hey, my pleasure. This was great. Thanks, Jeff.
Awesome.
All right.